Good afternoon. Thank you for giving us the opportunity to pitch in for the technology developed in our lab, which is bilayered multifunctional wound dressing. Dr. Mamta Pillai and myself have formed a team to take it forward for translation. My lab is actually primarily focused on biomaterial based technologies, and we use various kinds of biomaterial based platforms for applications including tissue engineering, immunotherapy, and in vitro disease models. Just to give an overview of the wound healing process, wound healing comprises of four different wound healing phases, including the hemostatic phase, when the blood clots and helps control the loss of blood, the inflammatory phase, where the immune infiltration takes place, followed by the migration of fibroblasts to cover the wound, and finally, the remodeling of the matrix, which leads to minimizing the scar. Various problems associated with proper wound healing are infection, inflammation, which can happen during the first three phases and hinder the subsequent healing of the wound. The prolonged inflammation also leads to chronic wounds, which compromise the wound healing process. The medical problem here is the occurrence of various types of wounds, such as chronic ulcers, including diabetic foot wound, open and burn wounds, and surgical wounds. And various kinds of dressings that are available in the market include gauzes, band-aids, and so on. However, none of them are multifunctional and are also very expensive. Specifically, they do not cover the large area of wound, typically have only antibacterial property, they lack the moist environment and are also non-biodegradable. So our proposed solution is the development of a multifunctional dermal patch. It comprises of two layers. The top layer serves as a barrier for microorganisms to prevent infection, while the bottom layer is incorporated with wound healing agents to take care of inflammation and have antioxidant and anti-inflammatory properties. The conventional dressings are thick and need to be changed every day, which further lead to increase in the cost of the treatment. While our dermal patch is a thin dressing which can absorb wound exudates, can be easily peeled off, and provide a moist environment for wound healing purpose. So The, for commercialization, we have identified the potential customers as the patients with various kinds of wounds, and the pharmacies, hospitals, and old age homes will be our first customers. The global market size for the dermal patch is close to 500 million US dollars, and our proposed solution is an all in one solution for various kinds of dermal wounds with a patented design leading to superior wound healing. Its low cost and better wound healing performance will give it a competitive advantage over its commercial counterparts. We have projected the pricing of our product to be somewhere between 200 to 350 rupees, which is much lower than the manual wound dressing in the hospital that may cost anywhere between 1500 to 50,000 rupees, depending upon the dressing used. We hope to partner with pharma companies who can potentially also help us with the regulatory and commercialization aspect. To summarize, we have developed a multifunctional dermal patch with superior wound healing and is also less bulky, cost effective, and easy to manufacture. Further, it can be tailored to cover large areas depending upon the type and size of wound, and it is a one-step solution for all types of wounds, and we are looking forward to its commercialization. So this work has also got some media attention last year, and we have already filed a patent for the same and are looking forward to its commercialization. Thank you.